So last week we did a prepper survivalist first aid kit. And I had some people say that they really liked that. And so...
Slightly different picture.
I know, I changed it a little
different.
bit. It's a little bit different.
You turned a different...
I turned a different way.
More forward.
Yeah, I know. I'm like going through my prepper poses there. Anyway, so this is once again, it's just, I mean, it's kind of for fun, but kind of serious. I want to talk about if you ever were... say at the end of the world, zombie apocalypse, or if you're marooned on an island and you had the supplies that we talked about in last week's episode. So check out that. So meeting people, throw a link up there, do your magic, put the link to like the first, I'm going to point to it. Where's it going to be? Like here? Put it right there, people. Like, so we'll put a link to like my first aid kit. But so I was thinking about, okay, well, say you're at the end of the world or whatever, or you're out on a desert island and you get a wound.
Yes.
Like, how would you treat that? If you had, certain stuff. And once again, I'm going to throw my disclaimer up. Please do not treat wounds yourself. We are not at the end of the world. You're not on a deserted island. If you have a wound, please go see a doctor. But this is just hypothetical. We're pretending here. We're pretending that it's the end of the world and how you would take care of wounds. And all right, so why is wound care important? I mean, you know this. I mean, wounds can get bad if you don't take care of them. Wounds can go south.
You can die from
you can die from wounds.
Yeah.
You can die from wounds. Yeah, exactly right. That's the biggest thing. If a wound gets infected and that infection gets systemic,
out of control,
yeah, you can absolutely die from it. And small wounds can get very serious if they're not treated properly. So, I actually have a lot of experience to this. So, in addition to being plastic surgeon, reconstruction, former trauma surgery. I've been director of wound care programs for over a decade, like big ones. So I treat lots of wounds. So I can actually give you guys some good information about this. So I guess the first thing you would ask, okay, what makes a wound serious? Like, what makes one wound, more concerning than another? Well, I mean, the obvious one.
The size of it?
Yeah, size, of course. Yeah, okay. Bigger wounds are more at risk. And I would consider size in two ways. Size, like surface area like this, and then depth. Yeah, depth. Because as the wound gets deeper, you start to get into more critical structures. Like you get into muscle.
And they have like layers of suturing, right?
Right, if you were going to close it, yeah. Because that'd be one thing is, can you close this wound? I didn't actually include that, but I'm going to talk about it.
One time my mom was walking in between cars at a parking lot and like where the license plates are, and one of them was like tailed,
she cut herself.
She slit her freaking leg so bad. It was so deep. Like it was like, I don't know, 3 inches deep. It was like all the way into her muscle and her
That's
fat.
Crazy.
It was disgusting.
That brings up.
And she was just like holding it. And I was like, cool.
It's like you read my mind too, because that comes up to the next thing I was going to bring up. What makes a wound serious outside of, area and depth, location.
Yeah.
And some of the worst place to get wounds would be like your feet and your lower extremities, your backside, your buttocks area and your groin. And so, what makes those areas worse? I mean, blood flow. The further away from your heart a wound is, the less blood flow it's going to get, the less ability it has to fight infection, and the less ability it has to heal.
Yeah.
That's why foot wounds are bad. I cut my foot like a week ago, and I had this wound for almost a week, which totally sucked because I couldn't run. And why is that? I mean, I'm in pretty good health, but it's on my foot. Like, it's just a bad area. It's dirty. It's far away from your heart. Blood flow is kind of sucky. So, if you were injured, you want to take assessment. Okay, how serious? I mean, all wounds can be potentially serious, but like if you have a larger wound, a deeper wound, it's in a location that is not considered a good place. So like feet, lower extremities, groin, your buttocks area, you got to be extra careful with. All right, so first step in wound care, at least in my opinion, is what is the status of this wound? Is this wound infected? I mean, a lot of wounds pop up as an infection. A lot of times when I get consults for wounds, is that somebody got a cellulitis and then they got an abscess, and then that abscess breaks through and they end up with a wound where all the pus was. And so, the other way people get wounds is like, injuries, like, you fall, you're working outside and like a log falls and cuts you. I mean, that's a dirty wound. You get like bacteria in there,
or
you get like debris.
A license plate cuts you.
A license plate, you gotta get your tetanus shot, right?
I think she did.
So, what's the source of the wound? Is it trauma? Is it infection? You want to get the wound clean as soon as possible, and that includes dead tissue. Because a lot of times whenever you get injured, and this goes for whether it be trauma from trauma wound or infection wound, you're going to have tissue that's not healthy. And this is where it gets hard for like the
what if it's like fresh? You don't have to worry about that, right?
If it's fresh, you can still get dead tissue because a lot of times what happens, a lot of people think, oh, I get cut with a knife. Well, if you get cut with a knife, like a straight cut, you're not going to have a lot of dead tissue.
Yeah.
Where you get dead tissue is like, say you fall down a cliff, right? And you get like shredded, like you get multiple cuts right on top of each other. Then you start to get dead tissue like in between the cuts, or like you get flaps of tissue where the tissue dies. And if you have dead tissue in a wound, that is a great, great place for bacteria to set up because that is food for the bacteria. There's no blood flow in that dead tissue, so the bacteria can just go hog wild, reproducing, eating up that food, making more bacteria, and then suddenly your wound is a big mess of pus and you're really sick and you die. So you don't want that to happen, right? So
that happened real fast.
Yeah, right. It happens quick. I mean, it doesn't really happen that quick, but if you were like, and once again, it's all hypothetical because remember,
we're on a deserted island.
Yeah, you're on a deserted island, or the zombie apocalypse hit. You want to check your wound and make sure that there is not infection in it, so there's no pus, and you want to make sure that there's no dead tissue. Yeah. And dead tissue is pretty easy to tell. It'll be like purple, black. It won't look the same as your like normal healthy tissue. It'll be cold.
Will it be pale?
Could be pale. Pale tissue sometimes I won't remove because pale tissue is not necessarily dead.
Okay.
And it might make a comeback.
Okay.
If it was pale, and I do this all the time when I'm debriding wounds. Like when I'm debriding wounds that are fresh that I get consulted for, something bad happened, like say like they had a bad infection or like a surgery went bad. Like I'll open it up and I'll start cleaning away dead tissue, and I'll get to tissue that's not super, super healthy, but it's not dead either. And a lot of times I'll leave that because if you go hog wild removing tissue, you're just making the wound bigger.
Yeah.
So you want to be a little careful about what you remove. But that is the first thing, remove any infection and then remove any dead tissue. Now, you also want to clean the wound, right?
Clean, yeah.
Yeah, clean. Now remember, we have our supplies, like our prepper kit or whatever. So how I clean wounds, I mean, soap and water is actually super, super effective at cleaning wounds. I would probably go something a little stronger, at least at first. I really love that Denton solution, which you can literally buy that stuff off the internet.
It's basically like chlorine.
It's the sodium hypochlorite, which is dilute bleach.
Yeah.
Great for cleaning wounds.
Yeah.
I like that. Hydrogen peroxide is good. The problem with hydrogen peroxide is it's actually kind of caustic to your tissues, and it actually can cause damage if you use it, too much or too intensely. So I personally don't use hydrogen peroxide, but it's nice because a lot of people have it. It's really good if like you cut yourself in the yard and get like dirt in it. Yeah, throw some peroxide in there. Give that one good cleaning to like really kill bacteria. But good old soap and water works really good. As far as keeping a wound clean. And most people have access to water and soap. So then it's okay, all right, you got this wound, you got all the pus out of it, you got all the dead tissue out of it, you've cleaned it really good with some sort of antiseptic, whether it be hydrogen peroxide or betadine or the hibiclins that you were talking about. I personally like Denton solution, I use that stuff all the time. So now what? You have a wound, right? So then your choices, like you mentioned closing stuff. In this hypothetical scenario at the end of the world, like if you have the prepper kit that I talked about in that one episode, we did include sutures and stuff.
Yeah.
You could make an attempt to close this if you have the know-how, which, it's the end of the world. Hopefully you got a manual about how to do some suturing. The thing about closing a wound is it does carry more risk of infection.
Yeah.
If you close a wound, especially a traumatic wound, unless you do it under sterile conditions and you're able to more or less sterilize the wound and wash it out, you just run the risk of that getting infected. Versus your other alternative would let the wound heal from the inside out. And so I'll tell you, when I get a wound in my wound clinic, occasionally I'll try and close them, especially if they're fresh. Like it's like something that just happened. I'll try to wash it out and close it. But a lot of times if it's something like infection, I'm not going to close that wound.
Yeah, my mom's cut on her leg from that license plate.
She had to heal from the inside out?
No, they just sewed it right up.
Oh, they did?
Because we took her to the doctor immediately.
And you did it right away. Okay, then that's fine. Yeah, that's a smart thing to do.
Well, she's a nurse, so she immediately was just
she knew it too. So
I think she probably had
I need stitches.
Yeah, she was like, I need, this is going to get infected. Just immediately.
So, if you have the ability to close a wound and you have the know-how and you have the tools, trying to close the wound is not a terrible idea. It's what, I would do for most traumatic stuff. The exception to that would be something a wound that came about from infection. You typically don't want to close. I never close those. I always, leave them open. So it's like, okay, well, say for example, you didn't have suture, You don't have instruments. Or maybe this wound came about from infection. What do you do? How do you take care of a wound? Well, I will tell you there is a very, very simple and very, very effective way to treat a wound to allow it to heal on its own. And that is a classic, what we call wet to dry dressing. And it's exactly like it sounds. You're going to take some gauze. Now, remember from last week, we had two types of gauze. We had woven gauze, which is the ones that like little strands. And then we had non-woven, which is like paper towels. You take a woven gauze and you pour a fluid on it. Now, your choices could be, I use that Denton's, the sodium hypochlorite a lot. You could use normal saline. Just the thing with normal saline is it doesn't kill bacteria. Yeah. It's kind of like bacteriostatic, but not bactericidal. So you're going to take a gauze, a woven gauze. You're going to soak it with one of those materials, whether it be either normal saline, Denton's. There's another one called Vosh, which is kind of popular. Vosh is okay. I mean, I don't dislike it, but it's not my favorite. But you're going to use one of those solutions. You're going to put it on the gauze. You're going to wring it out till it's kind of more like damp instead of wet. And you fill up the wound with that gauze. Then you put a dry one over the top and you wrap it up. Yeah. And you change that once a day, twice a day if it's a bad wound, like meaning it's like potentially a dirty wound. If it's dirty, it doesn't look clean, you want to do it more frequently. And you change it once or twice a day. And when you change the dressing, you clean it with soap and water again. And unless there's something crazy going on, that wound should heal. Yeah. And I mean, wound care really can be that simple.
But don't use dirty water.
Yeah, you want to use, if you have your prepper kit, then you got your saline. Yeah. You got all this stuff. I guess if you were literally on a deserted island, you could boil water. Yeah. If you have salt, you add it to that. It's better to use something more like normal saline, which is 1%, 0.9% salt per liter. You can make that yourself. It's not hard. You could use water, but you want to boil it, right? You want to make sure it's sterile. I mean, wound care technically is not sterile. We don't use sterile gloves to do wound care. It's clean. You want your supplies to be clean, but they don't necessarily have to be sterile. Yeah. But yeah, I mean, wound care can be that basic. A wet to dry dressing is kind of an old school surgery way to get a wound to heal, and it is extremely effective. And you really don't need anything crazy to pull it off. Definitely all the stuff we talked about in the kit would do it. So how do you know if it's working, right? So typically when you get a wound, it's going to be multicolor. If it's muscle at the bottom, it'll be pretty red. If it's fat tissue, it'll be kind of yellow or white. As the wound is healing, it's going to turn to a beefy red like a steak. That's how wounds look when they're starting to heal. It's we call it granulation tissue. So granulation tissue will start to grow, and that wound will become beefy red. Like I said, like a raw steak. And you're on the right track. And then you keep doing your dressing, and you let it heal in, and you're home free.
That's all you have to do.
I mean, really, telling you, wound care is not overly complicated. I mean, it's something not a lot of people...
As long as you just try to keep things clean, you'll be good.
Keeping things clean is paramount. A wound has to be clean in order for it to heal.
Change dressings.
Yeah, change your dressings, use good supplies. Soap and water goes a long way. Yeah. And it's funny because a lot of people think that you shouldn't get a wound wet, which is total nonsense. Washing a wound with soap and water is not only not bad, it's critical for it to heal. I get so many patients that come to my wound clinic and they will say, oh, well, they told me not to get this wound wet. And I'm like, that's total nonsense. That is total. Anyone who told you that shouldn't be telling you that. Clean a wound in soap and water in a shower is great. It cuts down the bacteria, very effectively. It removes non-healthy tissue. And those are two of the most important things for getting a wound to heal. So, all right, prepper wound care. It's not complicated. I mean, it really is pretty simple. Once again, remember, this is hypothetical.
Yes.
If you get a wound, go to the doctor. Please go to the doctor. Don't try to care for this yourself.
Knock on your door.
Yeah.